1/8 of deaths in this world are caused by a condition that is preventable, and millions of people are walking around with it and don't even know it. What is it? High blood pressure, also called hypertension. You or one of your family members or friends may be one of those people who have it but have no idea. Part of the reason so many of us are unaware of this possibly ticking time bomb is because so many misconceptions about high blood pressure exist, and with all the health information out there, how do you know what to trust? I'm Zane, a board-certified primary care doctor, and in this video we're going to talk about 3 of the biggest myths that people have about hypertension that might be part of the reason why it's misunderstood and why so many people continue to suffer from this preventable condition. Oh, and stay tuned till the last myth that you're not going to want to miss. Myth number 1. Many people think that if they feel fine, their blood pressure must be normal. The truth is, hypertension is usually asymptomatic and people often don't feel a thing if their blood pressure is too high. So if hypertension usually doesn't cause any symptoms, what's the big deal? The problem is, high blood pressure often doesn't cause symptoms until something hits the tipping point. A heart attack or stroke happens, or the heart can't pump enough blood through the body adequately, something called heart failure. Yes, some of these things can happen immediately if blood pressure is severely high, but more often than not, it's the silent, chronically high blood pressure over time that people don't feel that puts repeated stress on your body and can lead to permanent organ damage. Blood pressure that stays consistently elevated can increase your risk of things like cardiovascular disease, which is the #1 cause of death in the world. And the higher the blood pressure is, the higher the risk is. There's a reason why hypertension takes out so many people. A lot of them never feel it, so they never know they have it. Although the majority of people don't necessarily feel high blood pressure, if you feel like something is off or not right, listen to your body and get checked out. Myth number 2. Here in the United States, hypertension accounts for more deaths from cardiovascular disease than any other cause except for cigarette smoking, because it can wreak havoc on your blood vessels and surrounding tissues. In the brain, hypertension leads to strokes that are caused by blockages and reduced blood flow, but also hemorrhagic strokes where bleeding into the brain occurs. High blood pressure damages small blood vessels in the eyes and leads to things like damage of the optic nerve and glaucoma, which can then lead to blindness. It destroys the small blood vessels in your kidneys, which filter your blood, and over time this can cause your kidneys to stop working, something called end-stage renal disease or ESRD. This is when people go to dialysis, where a huge machine has to do the same work as 2 and sometimes even 1 tiny kidney. In fact, hypertension is the 2nd leading cause of ESRD in the United States, second only to diabetes. It even affects the largest blood vessel in your body, the aorta, which connects directly to your heart to provide your body with blood, oxygen, and nutrients. Hypertension can cause the aorta to get bigger and bigger to the point where it can burst or tear open, which often leads to death. But although hypertension can lead to so many terrible things, the good news is that it's treatable and these things are preventable. So controlling your blood pressure benefits your whole body. It helps protect against damage to your heart, your brain, your blood vessels, your eyes, and your kidneys. Myth number 3. There's an ongoing misconception that women don't get high blood pressure or heart disease. Millions of women have hypertension, and not only that, the majority of women over 65 have it. And cardiovascular disease is still the #1 cause of death in all adults, and this includes women also. For women, high blood pressure has a bigger impact on death from heart disease and stroke than any other risk factor. For men, only cigarette smoking has a higher impact. Not only that, there are types of hypertension that only occur in women related to the use of birth control pills, menopause, or pregnancy. During pregnancy, high blood pressure can be a pretty big deal. It can put both the mom and the baby at risk, so monitoring blood pressure is extremely important during pregnancy. Oh, but there's more. Many people usually think of high blood pressure as an adult problem, but children can get it too. In fact, 15% of kids have elevated blood pressure or full-on hypertension. A lot of this is driven by excess weight, processed foods, and not enough exercise, so put down the video and go outside or something. Taking your kids to all of their well child visits can help catch high blood pressure early and intervene before it causes major issues down the line. Keep in mind though, normal blood pressure in kids depends on their age, height, and gender. I'll leave a link in the description below to a chart of normal blood pressure in kids. So, now that you got a better understanding of hypertension, the next thing to do is to check your blood pressure and discuss the readings with your healthcare provider. A lot of people will require medications, but everyone with hypertension can make healthy changes in their lives, improving things like their diet or engaging in regular physical activity to minimize the amount of medication they may need. It's a great idea for people to talk with their healthcare providers about their blood pressure goals and how to reduce their own individualized risk of cardiovascular disease and the other negative effects of hypertension. So get a blood pressure monitor for yourself and check your blood pressure periodically so you know what yours is. Thanks for watching. Peace.